Hi, I'm Gabby.
Hello, my name is Xander.
My name is Riley Kirkpatrick.
Hi, guys. My name is Liv, and I'm going to be talking about a lack of access to healthcare. A lack of access to healthcare has become a huge problem, not only here in Indiana, but also throughout the entire US. Having full access to healthcare means having all of the resources possible to get it when healthcare is needed. These resources include money, healthcare services, coverage, timeliness, trained doctors, etc. A lack of access to healthcare is described as health disparities or health inequalities due to the fact that it is literally unequal among different populations. Although the United States has an abundance of technology, facilities, and professionals that can be spread widely throughout the nation, some parts of the population are still unable to access these. According to a study done by the National Institute of Health, a few examples are illustrative. Infant mortality for Black babies remains nearly 2.5 times higher than for white babies. The life expectancy for Black men and women remains at nearly 1 decade fewer years of life compared with their white counterparts. And these are only a few of the many statistics that prove that there's an extreme lack of access to healthcare for certain parts of the population. Part of the reason that there's such a lack of access to healthcare for these populations is due to the lack of financial resources. This may lead them to feel as if they can go without it, meaning they may not get medications prescribed to them or be able to receive any healthcare if it's needed without having to pay a huge amount for healthcare or medical bills. Along with this, there is a lack of employer based insurance. According to research done by the Commonwealth Fund, job based health insurance is the largest single source of healthcare coverage in the United States. And minority groups may not have access to the jobs that are able to give them benefits such as health coverage or healthcare coverage. So they're expected to pay for it themselves. Along with this, there's also a lack of source for care, like I explained earlier, which leads to inconsistent care for the patient. There might also be language barriers that can prevent the patient from getting the care that is needed or prevent them from being able to access healthcare in general.
I'm going to be talking about how this issue affects our area as well as Indiana in general. In West Lafayette, we're pretty lucky when it comes to location. We have 5 hospitals in Tippecanoe County, including 2 psychiatric hospitals, and we also have 3 federally qualified health centers. But even with this, there are still a lot of groups that struggle with different ways that limit their access to medical care. For example, with cost, it's one of the biggest reasons. In Tippecanoe County, the median household income is about $51,228, and the poverty rate is 16.1%. So because the population of the county is about 200,000, that means that over 30,000 people are living in poverty here. There's also the issue of insurance. So people with lower incomes or those living in poverty obviously could not afford medical bills, but insurance could really help. But the issue is that 9.6% of people in Tippecanoe County are uninsured, and in Lafayette alone, 12.8% are. The Community Health Needs Assessment done by the IU Health Arnett Hospital, which is one of the hospitals located in Lafayette, found that of those in the county without insurance, less than half had a family physician or were able to regularly see a doctor. So without health insurance, medical procedures, hospital stays, even just regular doctor visits are unaffordable for most people. They can cost thousands of dollars. For example, on the IU Health website, it says for an estimate, x-rays can cost upwards of $100, a colonoscopy over $30,000, delivery of a baby over $5,000, and a hip replacement over $30,000. And this is just an estimate. It's not including extra costs or if there's complications within the procedure or surgery. So there's also the issue of age. Almost 12% of Tippecanoe County is over 65. And then the language barrier, 6.2% of Tippecanoe County is linguistically isolated, which means that in a household, everyone over the age of 14 speaks a language that is not English and can only speak English less than well. So, like I said before, West Lafayette is lucky with our location, but that's not true for all of Indiana. Rural counties usually have a harder time getting healthcare, A 2016 report from the Indiana University Public Policy Institute found that those living in Indiana's rural counties had twice as much difficulty getting to a doctor as people living in other counties, not even taking into account of income or age. That's just because of the location where they lived. So Purdue University's geographic classification system says that there are 42 counties in Indiana that are rural, which means that there are 100 or less people living per square mile, and there are 33 rural mixed, which means 100 to 200 people live per square mile. So while Tippecanoe County is not as affected by this, we're not considered rural, a lot of our neighboring counties are, and a lot of counties in Indiana are. You can see in the bigger picture, the counties in yellow are ones that are considered rural, and in the smaller photo, the counties that are highlighted in pink, those are ones that struggle with health professional shortages.
Now we're going to be discussing the existing ways that the problem of lack of access to medical care is being addressed today. And so as you can see on this slide, there are a bunch of random names. These are organizations who specialize in this. So I'm just going to list them off and go through some of the bigger ones and just talk a little bit about them. So we've got the NAFC, which is the National Association of Free and Charitable Clinics. There is the PAN Foundation, which is the Patient Access Network. There is RX Assist and RX Hope. And GoFundMe is on there. It's not really the same as these other ones. I'm sure we all know what GoFundMe is at this point, but it can be used in similar ways, even if that's not the intended purpose. But yeah, so now looking at the big ones, to start off, there's the Healthwell Foundation. And this is a foundation. It provides financial assistance to help with medical expenses of all sorts. And some examples are prescription drugs, health insurance premiums, deductibles, pediatric treatment costs, and even travel costs, which is really cool. And according to the Healthwell Foundation's own website, in 2020, more than $650 million in grants had been dispersed, and more than 615,000 patients have received help. So that's a lot. They're doing good work. Another one is Needy Meds. This is a nonprofit organization that helps people find programs that can help their medical costs. And so you can search up things by drug name or even diagnosis. So it's kind of like Google, but in a way you're searching up for ways to help pay for your medical costs. So that's awesome. And the last one is Aunt Bertha, which as of COVID time, it's now known as Find Help. Their website is findhelp.org. But it was founded with a vision to ensure that Americans can readily find access to and access social services in their area when it may be needed. They actually just had their 10th birthday. And according to an article on PR Newswire from August of 2022, so right at the start of COVID, over 4 million people had been helped. And now Aunt Bertha's network covers over 1,100 resources in every county across the United States. And this is big because they were originally located specifically in Texas, and that's clearly they've dispersed and expanded, so that's awesome. So now looking at federal solutions. The federal solutions are, a little more regulated, but that doesn't mean they're in better standing than the other ones are, because the other ones are really good. But yeah, the first one we're going to look at is the Health Center Program, and this gives assistance to health centers with patients who are mostly uninsured or low-income patients. So it'll be kind of in rural areas or in places with a little more poverty. The next is the Rural Health Clinic Program, and that gives cost-based reimbursement to rural health centers. And the last one is Bureau of Health Professions, and this gives grants and training for people for areas of workforce shortage or that are just in general need of assistance. So they might give equipment to hospitals, or they might bring in new doctors who are currently learning to build their experience and become the doctors which might be needed at these different places. Lastly, according to the HHS, which is the Health and Human Services website, the HRSA, which is another federal organization, they awarded more than $1.3 billion to 1,387 health centers in response to the COVID-19 pandemic. So these numbers are high, and they do help out a lot, but even then, we could still use more assistance.
And lastly, we are going to be looking at some potential solutions to making healthcare more affordable and accessible. The first one is lowering drug prices. So, even in the midst of the pandemic, an article by Reuters in 2020 showed that drug prices were still increasing dramatically, and that people who need these medications might, face repercussions because of it. So if they lost their job, they might not be able to get their medications that might be life-threatening if they can't afford. Decreasing out-of-pocket costs is also a really great solution. So different insurances are different, but usually you pay a premium, which is just a cost every single month, but some insurances make you pay a copay if you haven't met your deductible. And that copay can get increased if you haven't met that deductible. So, for example, if you go to the doctor's office, your copay might be only $30, but if you haven't met your deductible, it might be $150. So lowering that out-of-pocket cost might help low-income families dramatically. ER visits are especially costly. From an article by Cost Helper Health, they show that without insurance, generally, somebody can pay anywhere from $150 to $3,000. An ambulance ride can range anywhere from $400 to $1,200. This can be extremely detrimental, especially in the case of an emergency, and some families might be hesitant to even call the ambulance or go to the emergency room because they can't pay that amount of money a month from now. And making healthcare more accessible is also a really great solution, keeping in mind that transportation is not, it's not something that everybody has. It's a luxury. Somebody who might be a senior citizen might be relying on somebody else to take them to the doctor's office, and they might not be able to every single time. Maybe having things out there like a rideshare service for the doctor's office, just like some other healthcare facilities have, or having the public bus times somewhere and making it accessible where you can get to the doctor's office from a bus stop. Expanding outside the office is an also really great way to be more accessible to your patients. So having video conference calls in a non-emergency, calls, emails, text messages, so then we can limit the transportation, especially in the midst of a pandemic. You're not seeing people in person as much. And then you can actually find out if somebody actually does need to come into the doctor's office. Language barriers are also a really big problem, but a way to solve them is having somebody who is bilingual on staff in every single healthcare facility. So somebody who maybe speaks Spanish can help somebody who comes in who speaks Spanish and doesn't know how to tell their doctor what medication that they need or what their problem is. And their doctor can also do the same and letting them know what are the solutions to their problems. So in general, your access to healthcare should be a given and not a luxury. You shouldn't feel like you have to work for your resources. They should be available to you, and you shouldn't have to pay so much out of pocket that you can't do anything else with your life. Facilities need to also take into consideration the poverty rates, financial issues, in their area, transportation in their area, and the cultural differences so they can be more inclusive to everybody around them.
With all that in mind, we recommend that you go look into your local health facilities and see what resources might be available to you. Anyway, here are our sources, and thank you so much for listening.